Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to try as best I can to help you understand the TMJ pain that people can have and how elusive it is and how misleading it is to find. And so for years people have worked around it and done all sorts of things when they had the TMJ pain and just never did actually locate it on some of them and keep telling the patient that there was nothing wrong, and the patient just almost goes crazy with the pain. And it is easy to find if you're just up on it and know about it. So I'm going to try as best I can to explain the pain and what causes it. And let's get into this. I'll try to do it as soon as I can get started with it. Let me get going here. Now this is a picture of the jaw joint taken by the University of Sweden. Some of the professors there cut down some cadavers right soon after they passed away or something. They were anyway fresh, and they cut through this. So when you're thinking about it, just don't think in this flat deal, but this is the condyle right here. And draw it off. And this is the fossa that the condyle fits into, and it goes up and opens over on this side right here. And this is the disc that we keep talking about. It's a biconcave device, fits right in here, and it has an attachment here, and an attachment here, and an attachment out here in front of it. And there is a double space. There's a tissue between the top part of the disc and the lower part of the disc called the upper space, the lower space. And this disc takes a tremendous amount of load, this thin tissue part in here. If you move your teeth forward to bite on something with your front teeth, this condyle moves out about here somewhere, and the disc is between it, and the only thing that touches is the teeth out here, and the condyle going into this disc right here, this double concave disc, except the condyle will move forward the same amount as your teeth move forward. I don't care who you are or what color or wherever you are. When you bite with your front teeth and your teeth fit properly together, the condyle is going to be the only thing that comes in contact with this disc. Now I'm going to have to kind of erase that, and we'll kind of show it. Now I'm going to move the condyle forward just a little bit, and you watch the condyle doesn't go up all the way in the fossa. This is the retrodiscal tissue. That's just simply the tissue that's behind the disc, and this is the disc right here. And when this portion right here has a tremendous amount of blood supply to it, and also a lot of nerve endings in there. And if you have to go back a little bit now, if you get hit in the jaw, and it doesn't matter who you are or what, your condyle fits right up against this, and the disc is here, and here is this retrodiscal tissue back in here, and this retrodiscal tissue produces synovial fluid, and so the synovial fluid has nutrients in it that feed the disc. the disc, the center part of this disc, takes all this pressure. There are no blood vessels and no nerve endings in this portion of the disc. There may be some in the outer portions of it, but none in the inner portions of this. And so the synovial fluid is pressed out of this tissue back here as you close. You'll have a gentle pressure up here, and this fluid, you see this stuff right around here? That's fluid that is squeezed out of this tissue and comes into the top, and also some way or another gets into the bottom joint space again. So I had to draw it off there. I hope you understand that. Everybody does this. And this tissue right in here, in other words, I'm going to draw this disc out again. It's a double concave disc. And this lump in the front and back, and that kind of, as the jaw moves out here, that keeps this under it, so the disc would be out in this area with the double concave in there. And that's when you bite on something in the anterior part of the mouth, the condyle hits and the teeth hit out here in front. And whatever you bite on pressure out here, the muscles are back here right over this area and here, and they pull the jaw too, but they pull it from the back side. It's like kind of like your arm here, where you'd have the muscle attached in front of the bone out here, and it raises your arm. But if you pick up 10 pounds out here, this ligament might have to run 20, 25 pounds to get the 10 pounds out in the front. It's the same way with your jaw. So you've got a lot more pressure back here than you have in the front part of the mouth out here when you chew. And so if you tie this like you break your jaw and you have it fixed together where it's really solid, and you push this condyle right up against it. Let me get on down to another part of this. I'll just skip this. Now I realize this is going to take a little time, and if you're just thumbing through the catalog, we'll just go and thumb it on. But if you want to know something about the blooming disc, stay with me. I'm going to try my very best to work to tell you what it is. And I've worked with this thing for over 30 years, and I was able to get everybody, as best I know, out of pain, but I could not solve the clicking back here. I know a good old surgeon, and he knows how to do that, but you have to operate on this and pull this disc back to do it. But let's get on with the rest of this part. I'm going to go forward now, and I will move it one step. Now the condyle has moved down some, and you see this disc again in here. This work done by the University of Sweden has been the biggest help to me over the years. And get this video that they have on it, showing this. It'll show this. I've shown it. I have it on as one of the videos. It really. Now the disc is moving down. The disc is moving down. The condyle is moving forward. Let's go back. Just see where. We go back to 1. The condyle. Now I'm going to move it. The shape of the condyle will change. In other words, it's changed from here and kind of back this way, and then it'll slide further forward. Now this is the second video of 10. I've just taken pictures of this movement. I can't show it moving for you. Now the pressure is let off on the synovial fluid, and this the retrodiscal tissue. It just gently pushes against that, and that feeds this disc. and that is works marvelously well if you take care of it. If you have pain with it, somebody will give you a little bite plate or something to put in there that'll put some separation between your teeth, and when you do, you move this jaw down and you give some relief to this. It helps most of the pain that you have in there. So let's go ahead to number 3 picture. Now, this has jumped quite a ways in this. If you get that video, you can see it. Now this is the fossa up here, but the condyle doesn't go up in here. It squeezes the portion of the disc into this area and then presses against this retrodiscal tissue. You'll get tired of me saying that word, but people don't seem to understand this tissue. It gets sore, and it is a ridiculous thing. It hurts like the devil, but it'll have spread the pain all over your body because people don't put their finger right on the disc. I mean, the part that's hurting. Now let's go on to number 4. And number 4, this is probably about where you would move your jaw out here and chew. It maybe is even opening wider, like if you're going to bite an apple or something, you open your mouth wide, this condyle is going to move further out here, and then, but the pressure is right in this area. This takes more pressure than you're putting on your teeth out here in the front. So you don't bite hard with your front teeth unless it's a desperate situation. You might bite hard then, regardless of what it damages. But you can damage this by biting really hard, or somebody clenches it over a period of time. It can give you some trouble there. Now, this portion of this disc has no blood vessels and no nerves in it. So you can kill it and you won't even know it. In other words, you can bite into it. Now there are some blood supply and nerves in this portion of the disc coming from the attachment here. Let me erase this again. And now this is number 4. Let's do number 5, and let's see where it goes to here. It just comes forward up here. Now the concave situation, then the pressure on it helps move this disc out like that. If you just watch you've got something deep into the disc here, as your disc. Let me just run through those real quick. Right here, you see that disc slides along with the condyle, and that's the way it's supposed to be. And that goes up here and it gets its food from this portion right here, and also the lubricant. The synovial fluid is, they tell me, the slickest things, that we're not able to reproduce something that slick. And it also carries food particles and food that feeds this portion of the disc. And it does a good job of it because my condyles are still working. And I've been chewing on this for 95 years, and it's still good. It's still working good. And I've damaged it by getting boxing and playing football and getting hit in the jaw. Sometimes it'll hurt and get better, but it never did knock the disc plumb out in front, where sometimes you'll get hit in the jaw and it'll push the disc completely out in front of the condyle, and then it'll click. And you can't do stop the clicking unless you go in and suture it and pull it back in. and I don't mind telling you about. I'm going to back it up here and show you what you have to do to suture this back. Now, this, I know an old surgeon, Dr. Wolford over in Dallas, Texas, is an excellent old surgeon. And he, if somebody has the disc off and he has to operate on the jaw, he always pulls this disc back up on here. But he's come up with a marvelous little way of tying this disc back. And he uses a staple. He puts two of them in there. It goes in like this, and these staples, if you know anything about driving a staple into a log or a barbed wire fence, one foot of the staple goes one way and one goes the other way. It makes it where it won't hardly pull out. You can't hardly pull it out. And then he'll have sutures into this staple like that. And so he takes the condyle, drives these staples in the back, reaches around with the sutures, and sutures into this disc, which is tough material, pulls it back up on there and sutures that. And the sutures stay in there for a good long while. He doesn't ever take them out. They just they disintegrate after a period of time, but the disc tends to stay back there, and he gets much better results with his operations when he puts the jawbone, the disc back in place where it should be. So that's Dr. Wolford in Dallas, Texas. Now here's number 4 again. And now this is number 5. It's coming around the corner. I'm going to erase that. You can see the disc better. Number 6, we're starting back now. So number 5 is about as far as it goes out in front. Now you can open your mouth wider sometime and get the whole condyle out here, and then you can't hardly close unless you can get the jaw and pull it down in the back and forward and then pull it back up there. You get somebody kind of have his mouth open and he can't close it. It really hurts, So you can do that if that happens to you. Now we'll go ahead and go back and do the 5, and then we'll go to number 6, and we're back again. This kind of gets in the way, but here is the fossa, and here is the head of the condyle. I don't care, I don't give a darn who you are. If you move your teeth forward, you're going to move the condyle some way or another. It can cock back forth like this, but it's going to move. And whoever says that anything we do to the teeth out here can affect the way this condyle meets and works in the back here. If somebody doesn't know what they're doing, they can cause the condyle to be further back and be pushing into this retrodiscal tissue. Now I'm going to erase that, and we'll go to number 7. It's going back, and you just watch the head of the condyle now. And this is the part that's on your jaw out in front, and this is fossa, and your ear is right back up in here, just a little bit. And the bone structure between where the condyle goes and the ear and getting to your brain is not very thick. And if you get hit hard enough in the jaw and it drives this condyle back and it pushes on your brain, it'll knock you out. And that's where people get knocked out. A lot of times they don't have a mouthpiece in. So if you do any sport, any kind of thing that you might get hit in the jaw, wear a mouth guard. That puts the teeth together and it takes the load off. So if you get hit, you can clamp your teeth together and the bone structure all up in here takes the blow. But if you don't, it can shove the condyle back in there and really damage this retrodiscal tissue that I keep talking about. It feeds it, and if it gets inflamed and swells up, and then you keep eating and chewing and talking and everything else, and the condyle keeps banging into it and irritating it, and people have all kind of pain for years. And a lot of times it shows up in your shoulders, your neck, your head, and all around over the body. They look for different problems. But if you put your finger on the condyle up here, right in front of your ear, and wiggle your jaw, you can actually feel the whole condyle as it moves around. And if it's really sore and irritated, I've had people, they wouldn't even let you touch it with this area. Now that's number 7. This is number 8. And watch this squeeze up now. And it's going to gently push into that tissue. And it squeezes as best I can come out with. It squeezes this synovial fluid through this tissue, comes out, and some of it goes in this part, some of it goes in this part down here, and that feeds the disc and takes care of this tissue over the condyles and the fossa. They're covered with a coating like this. It has to be fed to however the nerve endings may come out of the bone into that and supply it, but this doesn't have any. No nerve endings, no blood vessels in that portion of the disc. Now there's number 9, and you see this is folded up in here, and the number 10 is the end of the line, and when you push number 10, watch this area right here. That's, you can see the fluid actually come out. Watch it. If you look at it actually doing it, you'll see it more. But the fluid comes out there, and that, to the best that I can come up with, is where the food and the lubricant comes from there, goes up over here, and it feeds and takes care of this disc. And I know one thing, it can last all your life. And I am over 95 years old, and it's still, I can feel it working. It's smooth, it doesn't click or mess around. And that is a story of the disc. But if you damage this tissue back here, all you have to do is just get a blow. It can be a whiplash in a car. It hits back there, it jams this thing up there. You can get hit so hard that it'll knock this disc completely out here in front. And I'm going to do 2 or 3 other videos here showing the disc, what happens to it. And then there's some of them that have been tied to close together with so much force that the center part dies, and I'll show you that, and it drags it back. But I hope you get something out of this. This is a complicated, this joint is the most complicated joint in the body by far. And it functions and works, and it'll last you all your life if you take care of it. But you ought to wear a mouth guard when you go to any kind of sport, anything that you might get banged in the jaw. You should have a mouth guard in there. Now you can wear a strap around a helmet or something without hurting it, but like I say you could then put too much pressure on it, you could bother it some. And that's where stress and trauma are the 2 things that really work on it. I thank you for watching this, and I realize it takes a little time to sit down and understand this, and don't think of it as like a sheet of paper. Think about it, the whole rounded thing but the front of it is trimmed off so they could take these pictures, these high-speed pictures of it. And if you look at this video or this thing that the University of Sweden and these two gentlemen put on, it has been the biggest help to me understanding it, anything that's been done as far as I can tell. Thanks for watching, and join my group. I've got a couple of channels now, one on lecturing for orthodontics and one on just orthodontics period in here. And so I'd love to have you sign up and join that. And I thank you a lot. And I'm going to say goodbye, and I hope you'll come back again.